As Florida grapples with nearly 2,000 overdose deaths so far this year, Duval County will soon have a new tool to help keep kids safe and avoid an accidental overdose. At least that is the hope. Dr. Michaela Denison, an assistant professor and child and adolescent psychiatrist with UF Health, is joining us this morning. And good morning to you. This is certainly a huge problem, not just in our area, but all across the country, Doc.
Yes. Thank you for having me.
Sure, absolutely. So the number of young people dying from accidental and intentional overdoses continues to go up. What are we seeing here locally?
Locally, similar to the national data, shows that the rates of intentional overdoses and suicide attempts, or people using recreational drugs and overdosing, and then children getting into household items and medications, it's similar. I'm a child psychiatrist at the University of Florida, so a big passion of mine is preventing suicide deaths. And surprisingly, in Duval County, the youth suicide attempts are actually double the national average. And the way that most people attempt suicide is by overdosing on medications that are found in the home. Yeah. So that's why, this is really important that we educate families on this risk of intentional and accidental overdoses, and then help the families safety-proof the home.
It's so very important that we talk about this, so very dangerous, because these are drugs that are attainable, that so many of us have in our homes. So you are working on an effort to keep kids and families safe, and it starts with a medication lock bag. Can you tell us a little bit more about that? We're going to show a picture of what these look like.
Yeah, thank you. So the CDC, the Center for Disease Control, has had a big concern for a long time about the opiate crisis. And unfortunately, that's affecting children and adults, especially with the accessibility of fentanyl. So just taking one pill can kill you. So we received a grant, $500,000 from the Center of Disease Control through the Duval County Department of Health, and we're going to be purchasing at the beginning 5,000 medication lock bags. We're going to be distributing those at the University of Florida pediatric clinics and the pediatric emergency room. We're also going to be hosting community engagement events, and also partnering with the Parent Academy at the Duval County Public School events to just really spread these bags throughout Duval County.
It's so much more than just giving them out. It's about education.
Right.
Yeah.
We're also going to research the project and follow up with the families to encourage them to actually be using the bags, and speaking to them about any barriers to actually using the lock bags. So we're really hoping to provide initial education, but then continue that conversation.
Mm-hmm. What does research show about these lock bags? Do they really make a difference?
Yes, they do. Just like putting barriers on bridges have prevented people from attempting suicide by jumping, and removing guns from the home when families are in a time of crisis, setting any kind of barrier to a potentially lethal means for suicide. Definitely, there's a lot of data that shows that that can prevent deaths. And then we also know that that would really safety-proof the home and prevent these accidental deaths that we see a lot.
Mm-hmm. And Dr. Denison, there's an email address right now on the bottom of everybody's screen. Can people reach out with questions to learn more, to interact with you and your team of experts?
Yes, please do. The grant starts on September 1st, so we will be purchasing the lock bags at that point. And then we will be, rolling out the project at our UF locations, as well as community events. So if you are interested in learning more about the project and ultimately receiving a lock bag, please email us and we will reach out to you.
Okay. All right. That's so very important. We're also going to post this on our website, news4jax.com, in case you don't have a pen or paper, you don't write it down right now. You can also take a picture of the screen in the next 5 seconds, so that'll certainly help. Dr. Michaela Denison, you and your team at UF Health doing great things. Thank you so much for your time this morning.
Thank you.
All right.